Okay, before we move into Q&A, we wanted to see if our distinguished representatives wanted to have a word to address the crowd or bring your good solutions and ideas to the front.
Well, actually, I have a question, I think, that will get to my main point, but Vicki made some good points about finding a way to delay, and if we can delay to 2014 the Affordable Care Act, which I believe will actually succeed and go into effect, at that point all mental health services will be covered by parity by all insurance companies. So I guess I would like somebody to reply to that, whether or not, how far off I am about that. But that's a question. I don't need to get an answer right now.
Right. Does anybody want to? Well, Jim, Tara, Vicki,
we were just confabbing, and it won't help with personal care supports because it's not a mental health service. But if we develop one in the meantime, it is a mental health service, then we would maybe have parity.
I just basically want to say hello and let you know who I am, and that I'm very much interested and concerned about the situation that we place the mental health community in North Carolina. And we've not done right by you over the years, but it was not with ill intent. There were a lot of good people that felt like what they were doing was be in your best interest. However, like it is a lot of times with good intentions, follow through and oversight left a lot to be desired and did not accomplish what they had hoped to. I'm here to let you know that I want to work as hard as I can with all of you who are a lot smarter in this than I am. I'm getting there, but very slowly, to help improve the situation. Cure it, we never will. We will not reach a 100% solution for everybody, but we want to come as deadly close to it as we possibly can. Thank you.
Questions now, or do we summary?
Anyone? Ann, do you want to go ahead and?
Question first. Is it on? It says power. Can you hear me now?
Yes.
Okay. I'm just going to stand up here by myself just because I need it. I think this is this goes to Vicki. It says, how do we get the state to withdraw its stay?
We asked them to. You asked them to. We've already asked them to from a litigation angle. But I think if the governor in particular and the attorney general hear the reasons why and can be convinced that it is the right thing to do to avoid. See, I think the concern that I have is we're looking at the savings in the short term with personal care. We haven't calculated the costs, but we can start with Jenny's numbers of what it's going to take, the increased cost that it's going to impact the state, not just the state, but also the counties, because they're going to be, the sheriff's department is going to be increasing costs. So I think you guys organize some way of approaching the governor and letting her know that this would be a good thing to do. And I think you also need to seek out your natural allies. I think this is a situation where the adult care home industry, the group home operators, and NAMI and other people where all of the interests intersect. Now they might diverge later on down the road, but we're talking about buying more time.
Thank you. You mentioned a point about Jenny's slides. There were several people that wanted to know if they really liked her slides, and is there any reason why we couldn't make them available to people on our website, NAMI Wake County, so you can get it?
Sure.
Is that all right?
Yeah.
And one of the things I wanted to make a comment that Jim made a statement about he's balancing the least restrictive place for people with mental illness and costs? Well, group homes to live on a daily basis is cheaper than our Wake County jail per day. So that answers your question. Keep them out of jail and put them in and let group homes survive.
Yes.
Okay, just try. Here's I don't know who's going to answer this one, but do the 5600A group homes qualify for any of the $37 or $39 million appropriated to pay for the adult care homes in this setup? And if not, why not?
The 5600s do not qualify for the transitional funding. That was a discussion with the General Assembly, but those fundings are limited just to adult care homes.
Who does less work than 56A?
I'm sorry, Kel?
Adult care home, like assisted living facilities, with all respect, they do less work than 56A.
I understand what you're saying. I hear what you're saying. But the decision, I mean, that is a legislative decision.
I guess I'd like to follow up with a question in terms of, well, did the legislators that were involved in writing this legislation understand that it also affected the group homes and consciously omitted them, or just didn't know, sort of like those of us here tonight didn't know this was happening?
I can't answer that question. I don't know the answer.
I don't think so. I came into this halfway through the biennium, so I am really having to come up to speed on a lot of things that were done before I got there, or was involved at that point. Can you?
Well, I have to say I'm very embarrassed about this, but I asked a lot of questions about that $37 million, and group homes were never mentioned in it. And I didn't know that this applied to the group homes in the discussions that I had with in the General Assembly. So I can guess that it was really mainly the adult care home industry that was doing the negotiation, and they just didn't mention the group homes. That's just a guess.
But following on that, if that is the guess, then I think it's really imperative for us to sort of align ourselves with the group homes, the adult care homes, so that we can make sure that this can be corrected and join with them, because they actually have a good lobbying force and gives us something we need lots to do to get the word out. The next question is one of the 3 criteria, or the 5 criteria for ADLs, and the question was, how can these be appropriately applied to someone who has a disability that has to do with delusions, panics, deep depression, and their ADLs are really not the problem?
It's extremely different, yes.
Anybody want to comment on that?
It goes to the fact that personal care is not the appropriate service for our population.
Vicky, can I say, like we provide ACT services, sometimes if somebody in a depressed mood or delusional mode, if they don't take the shower, if they smell, we motivate them under the rehabilitative model. So sometimes the hands-on doesn't make no sense for people with the illness, you know? Prompting would be more appropriate.
Right, but the way it's currently written, it's daily, it's not periodic. You know, it's hands-on, it's not prompting. So it's the daily living skills that's really the problem, not the situational prompts that you might have to do depending on what's going on with that individual.
The other thing that's different that used to be there is assistance with medication. No? Yes? No? Okay. I'm wrong. Do you want to say?
Go ahead. The issue, med management was never a billable part of the service. So you really don't want me to hear that. What was happening is and again, I think both of my colleagues are correct. It was a service that was getting used to meet the needs of people in the group homes. We have the same thing going on with people with Alzheimer's and special care units. You don't always need hands-on. You need prompting, you need cueing. So it's a matter of what the service definition is. So it's, again, going back to fitting a person into a service definition. You will never get a service definition that is everything to everybody. That is why we have such a huge array of optional services in our Medicaid plan. If you look at our Medicaid plan, especially in the mental health arena, compared to many other states, we have a huge array, huge array. It's again, how it gets implemented, how it gets rolled out, and the access to it statewide.